I think they should know that they're very smart and inquisitive people, and they have very unique interests. And sometimes they may need help, but still, that means that they're still good people, though. And I think that the therapists can help people because they're very smart and they're very inquisitive.
I would want them to know that we may act differently, but not to judge us for behaviors that may seem odd or different, like stimming or speaking differently, or some of us can't speak, we're nonverbal, but yet we can communicate well in other ways. I think that's important for therapists to know.
Autism people, they can be different a little bit from everyone. They have like different social skills.
I think it's really difficult to come up with a specific idea of what they should know, but I know an experience I've had is that if you haven't been educated about autism recently, the knowledge that you may have learned about autism versus what the knowledge is right now might be really different. And I think it's really important to be engaged in what current understandings around autism are.
Have a nice calm voice. You need to be relaxed. Not do a stare down. Just kind of, if they need to look off or take time, just give them it and be honest. Just ask very minor questions if they don't want to talk. Ask for somebody that they will talk to, or anything will, like sensory items, to get them kind of moving. If they want to sit in the corner and face away from you and they don't look you in the eye, it's perfectly fine. It's normal. I do it. They don't look in the eye much. I don't usually. I've had a therapist help me with that. It's still really hard for me.
I think that they should know that the person they're working with is going to be very different from them. They're going to think differently, and they're going to understand things differently, and the therapist might not understand why they think that way or why they do those things, but yeah, I think it's important for them to know that and to be okay with it.
Repeat the cliche over and over again, but if you've met one autistic person, you've met one autistic person. We don't all present the same way, and that makes it even harder to miss. But and I speak for myself and all the other autistic people out there, there are certain things that we all kind of have in common. Like there are some baseline behaviors that I think we all share, like sensory sensitivities, light, noise, smell, like certain fabrics. I'll buy something like, I can't wear this, and I'll either give it away or return it or whatever, or I can't stand the texture of certain foods or whatever. Like that's disgusting. Why? Like an orange. If you gave me an orange, I'd starve to death. I'd never eat an orange. I know. And people love oranges. Like I hate it. I don't like. Ugh, it's disgusting. But so those sorts of things. I think that there's some commonalities. There's variance. Obviously, it is a spectrum. That's important to note. Like noisy, crowded environments, small talk. It drives me insane. I could do it. I can fake all that stuff, but I want to go right immediately to the dark stuff. Tendency to overshare, maybe a little bit too much, talking too much. I don't know. And change. I mean, I'm very routine oriented. I don't like change. I knew I had to know exactly where I was going today. Like the meeting the other day that I went to, I'd been planning to be there for like 3 weeks. I checked that address multiple times, which is why when I got there, wait a minute. And people don't understand, that's changed. I'm like, this is unpredictability, and I was expecting it. So I had a meltdown, what's called an autistic meltdown. It took me an entire day to recover from Friday. Like Saturday, I got up in the morning and I physically felt like I'd been thrown down a flight of stairs.
I think therapists should know about ASD people is that we are people too. Like we have our own wants, needs, and certain ways of doing different things.
A therapist, such as a doctor, speech pathologist, or any other therapist, could be more comfortable by understanding what the person's needs are and getting to figure out what they need to figure out what the person really needs.
I had someone help me out with social skills training. So if I didn't have social skills training, I wouldn't be who I am today.
Okay. What did they do in the social skills training?
So like so I learned about like eye contact, answering questions, like follow-up questions, interests, making sure like, you know, you don't talk about yourself all the time. That type of thing.
I think asking questions is always good, and paying very close attention to body language. Because people with autism a lot of times have a hard time saying what they need or what they're feeling, even knowing what they're feeling. And a lot of stuff you'll need to know through body language because they won't say it. And then it can get bad really fast if you're not paying attention to that.
Being there to listen to what I have to say, and then being able to be able to figure out where to go from there, and not be set, not have their heart set on a specific type of therapy. Like some therapists might be very good at CBT, for example, and that's their sole focus. But after a few sessions, if that's not working for someone, I think a therapist should be able to know how to either switch to a different type of therapy or send their patient to someone who can do a different type of therapy that might fit better for the patient.
Yeah, I think this is where my therapist shines, and she shines in many areas. I really, really like her. She's always, like, she closes every single session with be kind to yourself. And that's really, really, because believe me, I'm INFJ, the judgmental part. I judge myself way harder than I say things to myself internally that I would never, ever say to even my worst enemy. So it's something that I work on.
Making sure that the person knows that what they say is not like God's law or anything, that they can do whatever resonates with them, and if it doesn't, that's okay.
I know I've struggled around just like the expectation of eye contact with my therapist, and can get distracted from the session, and then like have felt doubt to voice that to them, even though, you know, obviously I'm sure everybody in the room would appreciate to hear that. So just, you know, being supportive from both sides to consider things like that, I think can be valuable, because, you know, when I find it difficult, if that kind of precedence had already been set, then it just might be an easier situation.
Talked very slowly, gave me things to do, written on paper, draw your feelings, really helps a lot.
It really just depends on the person, but I think sometimes it's not helpful to tell someone when they're struggling, like, what to do. Sometimes they just need to be understood, or like encouraged or acknowledged. Sometimes telling someone what they can do, or telling someone they need to do this, that the person knows that they need to do but can't, is not helpful at all.
I think some of my most unhelpful experiences have just been when I haven't felt very heard, and, you know, I think that was more just a human thing, not an autism thing, to be honest. But, you know, everybody wants to be heard, so I think that's important.
They can help them be included in everything. They're not alone, even though they can be different than anyone due to their social skills.
I think the worst thing you can possibly do is minimize, invalidate, deny the diagnosis, make it something that it isn't, or lump your client, patient, whatever you want to call them, into the same box as everybody else. Like, again, when you've met one autistic person, you've met one autistic person, and it's just just compassion.
That's
And
hard to answer. I think, just active engagement. I think, sometimes I feel like I voiced how I felt about something, and then like the next point of conversation kind of didn't seem to take that into account. So it's like, oh, okay, did you hear that or not? Because to me, that might have been an important detail relating to that.
It's not helpful for a therapist to maybe discriminate against autistic people or that sort of thing, or be mean to them or try to force them to do things.
Getting up-toned and high pitch really gets us a lot. Keep your voice low and calm. Try to keep distance. If we need to leave the room, let us. Just kind of stroll behind us and let us head to a safe place.
I think the most important thing you can do, I do have a big vocabulary, I just blank on words sometimes, but validating me is like, that's what I need. The constant, it's okay, you're okay, there's nothing wrong with you. This is not A, B, and C. This is normal, because being late, one of the things about being late diagnosed is that it's like finding out that you're a zebra and not a horse. Your whole life you've been like a zebra trying to be a horse or whatever, or you think you're the wrong zebra or the wrong horse, and you're just, it's like becoming a whole different person.
Just being validated feels really good. I'm not trying to claim to know anything with certainty right now, and it's just really nice to be able to be open and vulnerable and not hear some sort of negative response right away, but just being heard.
I have some things that I thought about that would be helpful when looking for a therapist.
Okay.
So the first thing I mentioned was I would like a therapist to be a good listener and not be judgmental about what I might have to say, and be open-minded. And with that, not pushing a person to pick a specific type of therapy, because there are so many different types, and it can be hard to figure out which one is going to be best until you've done a few sessions with a therapist. The other thing is to be able to have written communication, like a chat box or message box online. So if you have questions or concerns outside of your sessions, you can ask them. And then also, I was thinking it'd be very helpful on a therapist's website when you first are looking for someone, that they summarize the type of therapy that they focus on. And so so the patient can figure out what they're looking for, because a lot of times there'll be descriptions like CBT or DBT, but they won't give a summary of what that is. And so having at least a short summary of what type of therapy the specific therapist focuses on would be very helpful.